Welcome to the Heart of Prevention, helping clinicians stay up to date on preventive cardiology. This show features leading experts discussing real-world strategies to prevent heart disease, from lifestyle changes like diet and exercise to medical treatments, including new therapies. Whether you're a medical student, resident, or practicing clinician, this podcast challenges, informs, and enhances your approach to cardiovascular disease prevention. The Heart of Prevention, keeping hearts healthy one episode at a time. I'm Dr. Michael Shapiro, President of the American Society for Preventive Cardiology, and now here's your host, Dr. Keerthana Pakanati.
Dr. Dudum, Dr. Lakshmanan, Dr. Satish, welcome to the Heart of Prevention.
Thanks so much for having us.
Hi, Keerthana. Thank you for having us.
Hi, Keerthana. Hi, everyone. Thank you.
So, before we get started with today's episode, I'm really excited to tell you a little bit about our esteemed guests. Dr. Ramzi Dudum is the Assistant Professor of Medicine in the Department of Cardiology at the University of California, San Francisco, and has a clinical expertise in preventive cardiology and population health. Dr. Priyanka Satish is an Assistant Professor of Medicine in the Department of Internal Medicine at Dell Medical School at UT Austin and is a Director of Preventive Cardiology at Ascension, Texas Cardiovascular. And Dr. Suvasini Lakshmanan is an Assistant Professor of Medicine in the Division of Cardiology at Harborview, UCLA. So I like to always start off the episodes by just chatting a little bit about how you ended up where you ended up and what kind of drew you to the field. So I'd love to know, how did you recognize that this was going to be your calling in preventive cardiology? And we'll start with Dr. Dudum.
Thanks so much, Keerthana, and it's really exciting to be here with everyone. For me, prevention was really the combination of everything I enjoyed. I liked cardiology. I liked the heart as a pump, as a muscle, and I also, continued to be drawn to the experiences of many of us, which is a personal experience with cardiology, family members having heart disease and things like that. And ultimately, prevention stood out because all of the risk factors for heart disease, things like high blood pressure, obesity, diabetes, those were very, very big determinants across the population level. And so it was a perfect opportunity to be in a field I enjoyed from a pathophysiology standpoint. And also I was drawn to issues that could be highly prevalent, but also highly addressable. And so prevention really had it all for me.
Yeah, I love that. I definitely feel like a lot of people can relate to that personal aspect that drew you in and then everything else that kind of kept you there. Dr. Satish?
I agree with everything Ramzi said. For me, it was the realization that we can make so much of an impact on cardiovascular disease risk just by addressing risk factors and by prevention and, starting upstream. And we actually get that window to make that difference, and being able to be the person that gets to make that difference in someone's life. I feel that is very powerful. I also really like the data and the implementation aspects of this. There's so many very interesting challenges there. This field is growing like crazy. So it's a very exciting time to be a part of this field.
Yeah, absolutely. As you guys will see in today's episode, these are all early career preventive cardiologists. So definitely lots of things in the pipeline for all of them. Dr. Lakshmanan, what about you?
Yeah, no, I completely agree with what Ramzi and Priyanka have shared. Going back to personal experiences and connections with respect to family members or early, training in both medical school and residency. But I think the most profound impact has been with respect to my training experiences post-fellowship, especially with my mentors in the field of preventive cardiology. I think they truly embodied the impact that you can have when you are in the field of preventive cardiology, both personally with their patients, but also large scale with research and clinical trials. And I think that truly further cemented why I wanted to go into this field.
I love that. So we're going to try something a little bit different on today's episode because I thought this would be fun. We're going to do a rapid fire round. So I'm just going to say a topic and any of y'all can kind of let me know what your answer would be and we'll just see how this goes. So my first question for the rapid fire round is your favorite preventive cardiology paper that really changed your thinking.
I'm thinking of Select recently.
For me, it's the whole Life Simple 7, Life's Essential 8 paradigm that really shifted from a disease focus to a health focus and a maintenance of health.
And I think for me, I couldn't pick a single paper, but I think it would be all papers relevant to coronary calcium score and how it has transformed risk prediction. A little biased, but it stays.
Spoken like a true imager there. Okay, so how about this one? What's one skill you think every preventive cardiologist should work on mastering? Maybe not mastering, but should work on getting a grip of early on.
Communication and motivational interviewing. You don't really get taught that a whole lot, but it makes such a huge difference, especially when you're talking about prevention, because let's face it, a lot of the stuff we're asking people to do requires significant behavioral change and oftentimes taking medicines, which is not immediately going to make you feel better, but it helps you in the long term. So being able to build that rapport, I think, is a very underrated skill and one that serves you very well once you learn it.
Yeah, absolutely.
I think for me, currently it is about keeping up with the literature, interpreting the science, and making sure we are applying it in real time. I think there's a lot of gap in implementation. The field is growing very fast that we need to keep up. There's growing a round of therapies in prevention with respect to atherosclerosis, inflammation, like we are targeting it at multiple angles. So I think keeping up with the data, working with all the stakeholders to making sure the implementation happens, and also kind of like integration with imaging, so really getting into the innovation aspects of prevention.
For me, I think it's kind of this combo of epi and biostats, like understanding the prevalence of risk factors, the incidence of risk factors, and also how to communicate that risk. I think many of us see younger individuals, and so you're kind of pulling this juxtaposition between absolute risk and relative risk and how to communicate those things, as well as, what's actionable, 10% risk, 1 in 10 risk, and how are patients going to interpret those different things and respond to those different things, and really empowering our patients to make informed decisions. I find myself kind of relying on that backbone, really.
Yeah, I love that all of y'all's answers were so different, but really kind of stuck behind the patient, and everything leads back to the patient and how can we really help them understand what's going on through effective communication. Okay, so this is one that's kind of interesting, and maybe you guys have an answer. What's a myth about early career that you'd like to debunk? Like, what is something that people seem to think will happen in your early career that you were a little surprised by?
I think it's to understand that early career is probably a marathon, not a sprint. We've finished fellowship. It's a long phase. You want to continue to build your foundation, understanding that this is going to be a long term. So understand your foundation, understand your purpose, and try to work towards that. So it's not that you've come here now, you're again on the sprint trying to prove yourself. I think it's about widening your purpose and your impact. And so we want to take it in that stride.
So it's a marathon forever. Med school is a marathon. Residency is a marathon. Fellowship's a marathon. Great.
Were
Okay.
they marathons? They felt like sprints, but okay.
Maybe I'm still in fellowship, so I'm just, crawling to the end.
Yeah, it felt like a crawling sprint, but yeah.
The reason why I was going to jump in after is I agree so much with that. Is it's like, how long does early career go for?
Yeah.
And it's a continual process, just like everything we've done since even before we got into medical school. It's this continuous process of over and over, just trying to do good work in and out.
But it's also an opportunity in some ways. There's so much learning, like the learning really doesn't stop just because you graduate a fellowship, but there's also so much help. And I love what you both said because it's not a competition. It's nice that you get to develop in a space where you're supported, where people want you to succeed, and there's no competition as much. So it's a really nice chance to, like Suvasini said, like make an impact. And start looking at the longer picture, both, professionally and personally.
And I think in prevention, a lot of that is continuing to evolve in real time. With the advent of GLP-1s, that's something that, as preventive cardiologists, affects so much of what we do with regards to pharmacologic tools that can really help a lot of the prevalent risk factors we deal with in clinic. And also, you got to stay up to date on them, select, sustain, all these different trials coming out and helping us understand and equip our patients for short term, long term. What does that look like?
I love that. Okay, this is a maybe projecting into the future one, but what would be your dream prevention project, collaboration, goal, and again, it's a marathon, so I'm not going to give you a timeline for it, but what is something that you're hoping to achieve or your dream, you know, space in prevention?
I can maybe think of one. My interest is in the CAD space in the South Asian population. I would really like to see a whole lot of implementation and understanding that risk, but also really working on implementation towards addressing some of those disparities, increasing awareness, finding novel things that work for an individual person, and being able to tailor our therapies to their individual risk. So I would really like to see across the scale a lot more implementation, I think.
I love that.
Is this like a true dream, you mean?
Sure,
Was that the
yeah.
question? Yeah, okay.
Yeah,
How much are we allowed to dream?
Yeah, that's what I was like.
I'm
I'm just
really
going to
learning
go
a
for
lot about what early career looks like right now. Like, how much are we allowed to dream?
Yeah, I'm just going to go for it.
I love that.
No, so, my vision is looking at like a collaborative space in prevention where there's like an intersection for multiple specialties in a way, for example, like imaging or obesity space, and also innovation and research with like a clinical trials unit that interlinks the implementation. So something like a clinical trials unit that actively is working with the patients. It's integrating various aspects of innovation and science so that the patients are truly impacted by all the developments that's happening in real time. Yeah, maybe a unit like that.
You heard it here first. This is what Dr. Lakshmanan's going to do. You heard it here first. Like,
For me, it's very similar. It's like getting all of the who's on the dream team. I'd have the
Yeah.
behavioral economics experts. How do we nudge patients, providers, behavior change, right? The decision choice architecture experts, like how we structure decisions for providers, for patients, how does that change things? Health policy, public health experts, and then we need our patients at the table, right, as well, to help us figure out what is the right thing to do for the right patient, the right time. And also, as we're seeing with a lot of the access and payment and provider larger macro ecosystem, how do we execute those plans? And how does the evolving payer landscape change things as well for some of our medicines and therapies?
yeah, this is great. Okay, perfect. Well, we're going to segue a little bit. I know Dr. Lakshmanan kind of mentioned mentors, and I know all of you have reached out to a lot of us fellows in training to kind of see how you can help us achieve our goals. Who were your most influential mentors? And really, what sort of specific advice did they really give you that helped shape your trajectory? And we can start with Dr. Satish.
Oh boy. Um, well, I think all of us here have really benefited from so many mentors, like starting with just as a med student and resident. I had a great mentor at Case Western, and he's Rich Josephson. He really helped me like get into prevention, get started, learn about it, get interested. And then I moved to Methodist, and I was really fortunate to work with Dr. Nasser, who changed how I think about a lot of things. And just the way the mentorship really worked was in opening my mind to what was possible and what I previously thought I could not do, opening my mind to like, oh, now I can do it. Just being able to have that support, I think, has been huge. I've had plenty of mentors through ASPC as well. And plenty of peer mentors like Suvasini, who I reach out to on a weekly basis with questions about cardiac CT. So it really has been 360. And I think that is kind of the nice thing about mentorship, is that you can find it in so many different places.
Yeah, I love that you mentioned that some of your best mentors kind of changed your way of thinking and kind of opened up this area that you thought previously wasn't accessible. I think that's really cool. Dr. Lakshmanan, what about you?
Yeah, thank you. I have to start with Dr. Matthew Budoff. we've had a very long relationship. He's, truly kind of a true visionary for so many people in the space. He has set to influence so many young physicians, kind of even globally. And I think it's just that intention and that that guidance that he's given me. He's extremely benevolent, like everyone is a part of his vision, and that's why his impact is so far reaching. So that has had a tremendous impact, apart from, of course, training under him and now working with him. So, and I think that's very important. And I agree with Priyanka. It's important to have a wide array of mentors. I think different mentors can address different aspects of your goals and your career trajectory. I've had mentors, even, across the country, so to speak. I've worked with people internationally, especially the team at Edinburgh, who have also taught me this importance of collaboration in science and in the field. I think that truly also sets our field apart. So I think those would be the main lessons I gain from their mentorship.
I think what's so awesome is when you're talking about your mentors, these are like pioneers in the field and they're all so approachable, both to like early career physicians and also trainees. I mean, with the size of ASPC being what it is, it really feels like almost like a family that you can just walk into and everyone's really welcoming and encouraging. So I think it's very interesting to hear people talk about their mentors and be like, these are people that are actively in the field still. These are pioneers that are changing the field, but also you can just walk up and talk to them. I've always found that really interesting. Dr. Dudum, what about your mentors?
I agree with what you said, Keerthana, and with everyone so far. ASPC has really shown that you can have exceptional people and exceptional mentors be so accessible. For me, it's very similar to everything that Priyanka and Suvasini have said. At each step of the way, there's been a different mentor. I think the most impactful ones have come in residency and fellowship. Doctors Blaha and Blumenthal were just so amazing at supporting and guiding me and helping me develop further within prevention, think through good questions, how to answer good questions, how to make information accessible, readable, etc. And in fellowship, Doctors Marin and Rodriguez were just out of this world for support. And I just want to highlight one thing that Suvasini said that I think is so, so important, and I didn't learn this until later, that, each mentor can support you and provide guidance in different ways. And so you don't need to fill your cup, everything from one person. And I really also want to highlight what Priyanka said. Peer mentorship is just so important at this early stage of your career. Just like, what's happening in this? Who do you talk with about just the daily trials and tribulations that you're experiencing?
So what you're telling me is you're all friends and you're all in a group chat. And one day when I become an early career cardiologist, I can also join the group chat.
Hopefully we can continue to provide what ASPC has, is that you're never too early to start mentoring, and you can continue passing that forward and helping others.
And that's part of the goal of the, Fit Early Career Group, is being able to develop some of those pathways. So people who are interested in looking for some kind of structure to build that pipeline, this will hopefully be one of those pathways.
Yay. Awesome. I'm excited. This got me excited. Woo. So since we talked a little bit about next generation, I guess we're the same generation. The generation that's currently becoming preventive cardiology.
Yeah, just to clarify, what just happened?
You've aged us so much.
It's the wisdom. I feel like a baby. It's the wisdom. In terms of digital health, social media, other ways to disseminate information, how do you really think that's going to evolve in the preventive cardiology space? Like, how do you think that our ability to really disseminate information is going to kind of change and evolve? I'll leave that open to whoever wants to start, since that's kind of a loaded question, I think, a little bit.
Don't have, great pointers to it. I actually am not on social media for
this is why she aged us.
she's too busy to be on social media. She has goals and dreams, like the beginning of the episode.
Having said that, I do, take that second part of the question, the information that's being disseminated on social media. I think that is very important to address. I think all of us have a responsibility in ensuring that we are generating the right amount of information, like what the patients want to hear about, and we are able to address them in a systematic, evidence based way. And, so I do think, I feel that is very important that I, having up to date knowledge and I'm interpreting the science correctly, and however I can contribute to valuable information that's being generated. And I think that's where I feel the connection. I definitely agree that social media and digital health is very important currently, and the way it's being disseminated, it has a far reaching impact. So I don't take that for granted. But I think the key is that what goes into that is very important, and that we are responsible for that.
I think that's a great point you made about recognizing that just because you're able to spread information, you have to be really intentional and thoughtful about how you approach it, because there is such a thing as information overload, especially for a consumer or a patient who's trying to figure out how to navigate things. And if you're really intentional about what you spread into the universe, I feel like it can help patients really navigate that.
I love that. I might take it a little bit in a different direction about where preventive cardiology will evolve. But it's, to me, I guess, like literally one of the most exciting things, as is this whole chronic disease management space, right? How is care going to change? Where is care going to be delivered, right? I think a lot of where prevention can lead the way is healthcare is going to continue to change and evolve from this episodic nature of care. You have your annual, you go in for this discrete thing at this discrete time, to this more continual care. Our patients want it, right? And how do we continue care more as this longitudinal conversation, right? Patients come to us with data. They come to us with, how do you interpret this? What happens with that? This wearable said X. All right. So I think we should be leading that charge of how do we communicate? How do we think through this continual conversation of care, really shifting away from this episodic nature? Could, just give one example, right? GLP-1s are something where we're constantly titrating doses with patients. We're trying to figure out what the right dose is, how long they need to be on a certain dose. For one person, 1 month might be enough before they jump up to the next dose. For others, this side effect happened. How do we address it? What do we do? And then similarly, I think at the policy and care compensation standpoint is, how does that new model get reimbursed, right? If we're seeing patients more and more and we're communicating with them more and more, and it's for 5 minutes at a time instead of a 60-minute visit, we need to think through that. And I'm not smart enough to be in the room for those conversations, but I think our patients want to have us available to them and want to provide care for them in between visits, not just only at that annual visit. And so I'm really excited for how we can leverage new technologies and new approaches to really meet them and support them.
And as a society and as a community, this is where we need to go. This is where our patients live, and that's where they get their information from. So as much as we generate the data, if we don't have effective communicate methods to communicate it, it's going to get lost. And we are all facing this. There's a sea of disinformation that gets put out there. And as a consumer, it is quite hard to sort out sort out the wheat from the chaff. There's so much information out there. It's very difficult to know who to believe. And so this is someplace we need to go as a society, and the work that you are doing with getting this information out, I think that's commendable. And the societies are starting to recognize that we do need to have a larger impact, a larger reach in terms of our audience. The way we communicate probably needs to be looked at. Is there a better way for us to make this information more accessible, more palatable? I think those are all things that we need to look at when we're thinking about how we're going to educate our patients, because the days of I said so, therefore do this. I think those are over. It's going to be up to us to help put out there what the data shows and do it in a way that is both appealing and accurate. So it's an exciting field for sure.
Yeah, I think the idea of kind of blending everything that y'all said together is again patient focused. Where's the patient at? How can we meet them where their needs are? And how can we leverage where they're getting their information from through digital health or media to try to educate them more or maybe even fill in those gaps between their visits? Definitely a lot of things to think about in that space. Well, for any of the fellows or residents that are kind of listening to this and thinking about how do I even get started or what should I do to really find or create mentorship opportunities? Whether that's, especially if they're in a program that maybe doesn't have as big of a preventive presence, or maybe they're limited about how much formal training they're going to get. Where should they really start? We already mentioned the ASTC Early Career Fit group for sure. That's a great place to kind of learn more and reach out and create those peer mentors that we talked about. But we'll start with Dr. Dudum on where you think that these, residents and fellows, where to find you, basically.
I love that. And, to me, find somebody to help, right? Locally is always preferred for access. If you can't find anyone locally, national organizations like the ASPC for prevention specifically, ACC has a prevention section, Leadership Council, et cetera. There's the AHA, EPI and prevention, right? So all of the national organizations have groups where you can reach out and say, hey, this is where I am. Can you connect me to somebody if you're not able to find somebody at your own institution?
Your state chapters can be a pretty good resource too. Often there is someone within your state chapter that is often willing to connect and help. And I co-chair the Texas ACC prevention section, and oftentimes people will just reach out to either the president or one of our staff members, and they'll connect and get them connected with one of us. So that can be another useful place to start also.
No, I agree with what Ramzi and Priyanka have said. And I think while reaching out, be intentional about your goals, be specific about your goals. It's a mutual two-way relationship that can be built. So I think first step is reach out.
Awesome. Thank you guys. So, I wanted to kind of ask, each of you represents this new wave of leadership and prevention. And so, what's one early career learning moment that really has helped you kind of grow and you've reflected on since you've made it out of fellowship? We can start with Dr. Lakshmanan, if that's okay.
Yeah, I was thinking about this. It's actually exactly a year since my fellowship. So it just feels like, thank you. It just feels like, that I'm coming out. I think the important part is to recognize the opportunities that lay ahead of you, to start working with mentors, with collaborators. It's like an open field out there that, people are really rooting for you. So you really have to back yourself up and have some intentional goals that you want to work with everyone in making an impact. So understanding the needs of the time. So it's really to honor the early career moment, actually. It's a great space to be. So I think it would be to leverage all the stakeholders and move forward.
I think also building on that, I think this is an exciting time to sort of figure out what you want your career to be. And at least for me, fellowship kind of felt like learn cardiology, learn preventive cardiology, become really good at it, get some papers published, this and that, get a job. But, right, it was very goal driven, but that was kind of the time to, figure out where do you want your career to go? What do you want to be the focus of the rest of the next so many years of your attention? And I think this is an interesting time to reach out to those people that can help shape some of those thoughts and help shepherd you in that direction as well. But it really requires a lot of introspection of what are the things that I'm going to be doing. And I can tell you from trying to build a program, it's an endless world of possibilities. And even though you want to do it all, you actually have to kind of pick and choose. So I think that just trying to be intentional about what it is you want out of this and thinking big picture is probably helpful.
And I think that's a natural evolution as you go through the whole process. In medical school, you're completely undifferentiated about what I remember every subject. I was like, oh my God, this is so cool. I'm gonna be an immunologist, right? Oh my God, the brain, right? Like, whoa, go through this process. And I think as you continue to go through that, you like reflect, and it's this constantly evolving introspective process, checking in with yourself. Is this what makes me happy? Is this what I'm interested in? Do I wake up, passionate about what today is and what tomorrow has? But that thing Priyanka highlighted about there's so much to do, there's so many different things. You want to say yes to everything. Being able to start and sometimes asking for help. What can I say no to? What should I say no to? Right? Like those types of things is something that I'm still learning and continuing to evolve, as I think many of us are, because there's so many exciting things out there where if time was limitless, we'd be like, oh yeah, I'm going to do that today. I'm going to do that tomorrow, et cetera.
I feel that, all of that. I'm like taking mental notes for when I'm in y'all's shoes. One thing I kind of wanted to chat about is, especially compared to some of my peers who are going into more procedural driven, specialties, I sometimes find that early career cardiologists struggle with defining success. And so how do you really define impact and success within your field at this point in your careers?
I mean, I'll take a stab at that first. I think that's a really interesting question, and it is structured in such a way highlights that different fields offer different opportunities for RVUs and things like that. And prevention is inherently not as high RVU generating as many of our procedural specialists in cardiology. But I think a lot of it, again, goes back to that introspection of how do you define success. I find a lot of joy in helping my patients along a really long journey, which is prevention, right? What we decide in one clinic visit might change as the goals of our patients change, as the data surrounding us changes. And so that's something that I feel is important for success is joy in work and helping people. It goes back to that like very initial concern. And then when you're looking at jobs, you have to find places that are going to support you in that growth and opportunity. If your organization says success is this, you need to make sure that how you are set up is going to be able to achieve those things. And that varies. And that's, I think, something that as you go through interview processes rather can continue to be elucidated.
I think success for me is defined by impact and just being able to build that partnership with the patient and being able to build a program that provides this kind of partnership for patients that cannot get it elsewhere. I think that's a value add to the program, and it makes me want to get up every morning. So there's the Ramsey that being very honest with yourself and with whoever you're interviewing with when you're looking for jobs with it, in terms of what exactly can you bring to the table and how they're going to measure that and what they want out of it. I think I think that's a very important conversation to have, especially in a field like preventive cardiology, where your impact is not measured just in the number of procedures you do, for example. So I think that having that conversation up front and trying to find a match in terms of what you want, but also what they want from you, I think that is key, because that defines whether you'll be valued or not, and that defines whether you'll be allowed and get the support to build. So I'd say that that's pretty important.
Yeah, some very honest and deep thoughts for both of you. So thank you for sharing that. And, I just want to build on those because those are very valuable insights and very practical. It was interesting, the framing of the question, that it was in the context of procedural specialties. And I think, it is really important for us to have that conversation before we have that conversation with the person who's interviewing, to have that conversation within ourselves and to truly define, how we are valuing ourselves, what we think our potential is, and how we are valuing our goals and whether they're all aligned. I think it can get very confusing. Cardiology fellowship is a very fast-paced fellowship, and I understand there are a lot of external influences, and we have to take it in the context of that conversation and introspection that we have within ourselves. So I think success would be if that internal conversation and that external conversation are aligned, that would be success. And that usually translates into purpose and impact. I agree with what Ramzi and Priyanka said. So it's that important process to address. And I actually think we should start addressing this during fellowship. Maybe, that is before the job interview process, so that we truly know what we bring to the table, because the conversations can get rather confusing, actually.
Yeah, I agree. I'm like, I don't have any notes. I feel like I kind of wish we had had this conversation before I went through my interviews, but but I definitely
Keerthana, I am certain you did well in your interviews, but I think one of the things that nobody tells you as you go through that job search process is that it's a process. Places need to be hiring, right? The conversation continues as you learn about a different program or a different thing. Then you talk about hey, it's very different than residency, fellowship.
Yeah, it is very different. I definitely texted, I think, Dr. Shapiro at some point when I was kind of stuck between two jobs, and I was like, help, please. 'Cause I, but I'm very fortunate that there was a lot of support for where I stayed on in Washington, and definitely will be reaching out to all of you and definitely to Dr. Satish about building a program. But we'll definitely have to run this back before the next interview cycle. We'll have to do a whole session on this. I definitely do want to talk about, what's something that you think you could give a piece of advice. We've talked a lot about current fellows and addressing the fellows, and maybe this was really just a mentorship session for me in disguised as a podcast. What's one piece of advice you'd give to trainees or even to a younger version of yourself about kind of where your career's gotten to you and about pursuing a career in preventive cardiology?
To somebody who's undifferentiated, I would say totally consider this. It is a super rewarding field there, and you can go so many different ways in preventive cardiology, and the field is going there. There are plenty of people that are interested in longevity and prevention. So I think it's such an exciting and developing field. So this is a great time if people want to get into it.
I think I would say start building on the dream, develop your skills, reach out to mentors, it's a whole process, and make that journey very enjoyable. I think that's what I would say, keep going forward.
Enjoy the journey. I
Mhm.
like that.
Yeah. First, y'all are so thoughtful, and I really have enjoyed learning from you guys and how you approach things. I think my advice would be very similar, which would be just continue checking in with yourself. That introspective version. Are you happy? Is this still what you want to do? You did that yesterday. You said that's what you wanted to do. Is it still true? Does it bring you joy? Does it bring you happiness? But yeah, I wake up every morning and I love practicing this type of medicine, right? I think it's absolutely fascinating. I think the field is evolving around us, both from a scientific standpoint, but also from a care delivery standpoint. And we get to be a part of that, right? We get to think through all of those different things. And again, working in partnership with our patients. And I think prevention has really helped continue to lead the way in that area of working with our patients to help them achieve their health goals and improve their health span.
This has been a really fun conversation for me. I feel like we covered so many different topics within early career and really even changed my idea of what I thought early career was. And we still don't have a timeline for how long early career lasts, but maybe y'all will be able to answer that for me at some point. But I think one thing I really enjoyed is how different each of your perspectives were within kind of where your journey has been thus far, but also what you're doing in your early careers. But everything brings back to the patient. And I think the core of being able to educate our patients and kind of meet them where they're at. But this was really fun for me. Thank you all so much for taking the time to chat.
Thank you so much, Keerthana. And
Thank you,
you to everyone
Keerthana. This is
else.
so great.
This was terrific. Thanks, Keerthana. Thank you, Priyanka and Ramzi.
Thank you so much for listening. To learn more about the ASPC, please visit our website at aspconline.org.